Imagine, as a newbie on the block for veterinary medicine, you walk into your first job as a veterinary nurse and you're welcomed by a confident, collaborative, and fully committed team, where every member obligates themselves to perform gold standard care amongst their practice. A place where not only do we see veterinary leadership, but also nurse leadership roles. Stepping into a world of opportunities, actively managing risks by performing evidence based practices, and the creation of consistent and effective patient safety. A world we don't only have to imagine, but a world we can make happen ourselves. The Royal College of Veterinary Surgeons, or RCVS, defines clinical governance as a framework for continuously improving the quality of veterinary services that we provide, ensuring high standards of care for patients that cannot speak to us. Clinical governance is the framework movement towards presenting an easier way to consistently improve in the veterinary field, a field that is consistently becoming more complex and serves as a backbone of actively improving, striving for the gold standards of care. We can prevent harm and promote benefit and well-being as well with a clinical governance framework, using it as a tool or a pledge of excellence and a mindset, allowing an easy to follow guideline and idea platform for others or yourself to follow. Following a visual aid like this or a practical guideline framework not only allows accountability towards it, but it allows better understanding of why among all groups of people in the field, such as beneficence and non-maleficence, or doing the best good and avoiding harm to animals as best we can and where we can. Integrating the structured, systemic, multidisciplinary practice of multiple elements allows tools like quality improvement, consistency, efficiency, and accountability, not just focusing on the individual elements of quality practice such as clinical audits or benchmarking, but using them together to create a wider community to create measurable and meaningful outcomes. Veterinary nurses can take this on in their leadership roles as actable, trackable processes to lead real proven improvements in enhancing our professionalism of nurses. This means we can rely on results of measurable outcomes to improve, monitor, and evolve our clinic standards based on the patient needs that we find, and updated scientific and evidential knowledge towards new protocols, a culture created and derived from continuous excellence and continual professional development. As I walk you through this talk, I will be talking about a variety of different tools commonly seen and explained by clinical governance frameworks that I have found, in which I will leave here for your reference if needed. A framework of accountability, like I've said before, describes and pursues not only meeting care standards, but exceeding them. Exceeding client expectations, exceeding your own skill expectations, and exceeding the public expectations of the veterinary field, including communal and societal understanding of it. But why is this a critical action? Why do we think this is hard to do? It is a challenging thought to rebel against what we have always been told. Skill is only inherited, not developed. Skill is only a mindset, a fixed mindset. But clinical governance allows us to realize that this is not true anymore. It gives us a window into the contrasting modern emphasis that we encourage for our veterinary nurses today, not only for medicine and care, but as individual people in the real world as well that can reflect into our work, promoting the courage to change. No matter how skilled you are, how practiced, how experienced, how much sleep you get the night before, human error is inevitable and it is not your fault. It is the systems that fail us. When we have our animals' lives or our human companions' lives in our hands, we need to do everything possible to reduce these risks and optimize clinical effectiveness with constant evidence-based care, delivered by a multimodal approach, system thinking approaches such as checklists, standard operating procedures, regular auditing systems used consistently with other structures and tools can be measured for effectiveness and adapted as required to achieve optimal outcomes, safeguarding patient safety in busy workflows especially. which can be compared against industry standards or peers to encourage innovation and consistent improvements, which leads me to enhancing professionalism of the whole team. Skills and confidence are only the baseline to true gold standard care or nursing. The obligation to improve consistently and implement tools for evidence-based learning will encourage team members to walk alongside you to improve care quality. Body can ensure they are up to date together with the best scientific knowledge and techniques to showcase safety commitments and professional excellence. Adverse effects can then be managed with integrity and truth through incident reporting systems and significant audits, allowing changes and prevention of further occurrences and enhance public trust when we are open about our work. As individuals are encouraged to self-reflect, develop skills and communicate, interprofessional relationships enhancing confidence and combining their skills and coming together to provide the best care to their patients, increasing job satisfaction for everybody involved, building confidence in veterinarians to delegate consistently to nurses, improving workflow and individualised consistent animal care. Systemic approaches such as standardized protocols, evidence-based nursing, is then inspired majorly, minimizing errors and ensuring patient safety and the most optimal outcomes, showcasing veterinary competency and skills, improving confidence in the whole team, not just the vets. Clinical governance encourages a team-centered approach with shared goals and learning like this is beneficence, facilitating communication, reflective practice, and teamwork whereby the culture brews cross-disciplinary training and mutual respect, and workload balance amongst all, which historically hasn't been a culture associated with VetNed. Clinical governance and collaboration of systems then enhances public trust in the veterinary team, as said before, and profession as a whole. As we grow in confidence and skills, nurses enhance public perception, as said before, of the profession, include them in decision making, and demonstrate positional power as integral members of the veterinary care team, taking charge and doing better for the animal. So an opportunity to enhance the veterinary profession. As frontline workers of veterinary care, nurses can empower clinical governance to develop skills and take on greater responsibility in niche nursing realm, especially when delegated by the vet in a busy workload or day intensity. Further developing safety for patients as nurses are free to care for and confidently take on life-saving procedures or steps toward patient outcome improvement in their day. Following the fact that we are at the epicenter of patient care and structures, providing the opportunity to expand our responsibilities, to actively engage in the team more, influence clinical decision making with policy, and advocate more for patient safety with better reasoning than we ever did before. Alongside codes of conduct, legislations and guidelines applying to veterinarians and nurses alike, both separate and together, standards of care to uphold professionalism and assessment of our current systems and identify where care could be safer, kinder, or more effective. I have focused mainly on one quadrant of the clinical governance framework, evidence-based practice and quality improvement out of the bigger picture. A team member to confidently relay and justify clinical governance frameworks must have the cognitive and technical and interpersonal skills that can foster a culture of organisational and accountable team players to clinical governance ideas and promotions within the workday. Where do I begin? Where do you begin should really be the question, actually. The key to improvement lies in preparation and planning. Success involves being prepared for the possibility of failure, having a plan for that failure, and being willing to adjust and pivot when things go wrong, says Atul Gawande. Reflective thinking skills to evaluate personal performance in patient care, growth mindset, viewing areas of failure as a learning opportunity and skill development, embracing challenges and setting realistic goals to break down stigmas and barriers around failure, promoting a sense of accountability, confidence, and increase job satisfaction to continually develop professional skills. Animals cannot tell us their worries. Critical thinking, such as promoting clinical governance ideas, accountability, and knowledge gaps to do better in the future. And then lastly, analytical and technological skills proficiency, which means actively engaging in team debriefs to gain new knowledge, recording and collecting of the new knowledge, and identifying system failures integral for system success. We can engage in tools such as data management software, clinical audits, and benchmarking within our team discussions, practice, and training to implement these tools. But where's the catch? Sounds good on paper, right? I guess with everything else in the world, there are going to be barriers. A big one I see people questioning is the lack of time and resources, a very big aspect in our lives as a veterinary practice. But we can implement small, manageable changes slowly because we all know that staff shortages and busy clinic schedules are a guarantee. And much like conducting several reflective meetings and a checklist to record for new and experienced nurses or other professionals that enter the team can easily be delegated and use other members of the team, including those clinical governance tasks. Utilising digital tools to streamline the process and make change easier can also be used in this situation. And then we have resistance to change. We all have that one person not comfortable with changing ways or going off the surface of what already works. But we can use transparent and beneficial communication with the whole team in decisions like these, such as patient safety, emphasising benefits to the team, professional development and job satisfaction, with gradual implementation by focusing on one task or skill at a time, and then we check in with staff frequently to review thought reflections in these changes and create an open space for feedback. Blame culture. A common societal approach like scapegoating, finger-pointing, and blame on others can in fact be avoided. If we implement successfully a culture of truth and accountability, a safe space can be created to make mistakes and learn from them. Poor communication and collaboration is not such a big deal. If collaboration is ineffective though, it could result in system failure, the very thing we are trying to avoid. But a fear to do wrong can be inherited by the wrong team culture, discouraging engagement and communication breakdown, leading to these undetected mistakes that could prove fatal. We need to display model behaviour and holding yourself accountable for this positive environment. You cannot control the thoughts or actions of others. It is just about education of adopting growth mindsets and thinking skills in your own bubble. Education of implementing regular team debriefs of both positives and work-ons, or doing a course as a team to learn how to communicate with each other better. An anonymous reporting system alongside transparency when things go wrong can create confidence in improving change or providing change in that way. Share progress, create trust, and address challenges in a supportive light. Praise the good things, but also support the mistakes with no punishments whatsoever. We are only human. Proactively let team members in on why and when clinical audits and benchmarking are going to be ahead, used or measured, exclusively letting them know that it is the system measurement of outcomes, not the individual skills or failures. Which leads me to limited leadership support. Without support, clinical governance skills and initiatives may lack direction or incorrect implementation. Who would be happy to step into the leadership role? Collaborating to educate the team and ensure correct implementation, providing nurses an opportunity to step into a role of leadership and niche specialisation for the team towards a desired outcome. In a smaller team, discussion regarding potential roles may be a strong start, allowing the choice in specialising in specific tools or skills and leadership training as needed. Encouragement to take charge and model best practice as you learn it. Take responsibility for your own improvements and actions. CPD encouragement, finding accessible training resources, online or in person, CPD courses on clinical governance topics, mentorship programs, and case studies within your own clinic and or the wider community may be beneficial. However, there is an overwhelming volume of processes as well. I personally resonate with this one. Just like studying or taking on a new job with a new set of skills required, prioritising summarised key areas may be a strong start to an understanding. As we all know, implementing multiple new skills or processes all at once can be a very daunting concept and can lead to burnout. Give yourself a systemic approach to the understanding of one process at a time, regularly adjusting the process you focus on, and ensure that are suitable in a suitable fashion of implementation. For example, a problem has been identified with our surgical nursing not being adequate enough to keep up with nearby veterinary clinic outcomes. First of all, as a team, we can come up with a surgical checklist, combining baseline values and skills from case studies of various patients' signalments inside the clinic. From there, we can create a precise guideline on how to utilise the surgical checklist itself to ensure that the approach is always consistent between team members. As this gets underway, a clinical audit can then be requested to check that the checklist is being filled out thoroughly to ensure consistency, accuracy, and precision to protect patients in the question. As the checklist is being followed, we can measure patient outcomes resulting from the implementation of the checklist, to then compare it to the in-house results prior to the implementation, and analyse the surgical checklist in providing the desired and improved patient outcomes we were hoping for. We then question if there are any underlying issues with the implementation that could have altered our results, and address it thoroughly. To ensure accuracy and accountability, re-auditing and reflecting on the outcomes also is a must. I hope this talk has been an inspiration to take on higher responsibilities and roles as fellow veterinary nurses, and to deliver and develop quality, safe and meaningful care through the guidance of our clinical governance. And here is my reference list.